thought Jess did a wonderful job with the weather this morning to make this fabulous morning. And it's a great morning for a lot of reasons. We're here to celebrate the groundbreaking for the new Farge Medical Clinic, and there's a few people we need to thank, and we'll get along with the program shortly. Thank you all again for coming out this morning and helping us to celebrate this great event. Thank you to Jessie Cunningham and her staff, first of all Eunice Hillman and Kevin Renley, for really getting this put together for this morning. A lot of planning and a lot of preparation for this ceremony. A big thank you to the community of Lafarge. I think you've been involved with conversations about this clinic for some time, and really we tried hard to listen to what you thought you needed in this community, and also listen to our staff and how we wanted to move forward with this project. I have a huge thank you to the staff of the Farge Medical Clinic. Every member of this staff was involved in planning this facility, areas that they would be working in, really thinking about how the patient traffic would be coming and going, and then also trying to make this clinic really look like it belongs in this community. Very carefully designing so it's not ostentatious, but very efficient, effective, and really also warm and friendly to the community and the patients we serve. So again, thank you, staff. Really had interesting discussions all along the process, and again, thank you to River Architects. I think Val Schuette's here. Mike Swinghammer from the firm was our lead with this project. He's unable to be here, but just talking about the processes and planning and the design really led really good conversations. Lots of time commitment, but again, everybody was invested in that, and it was just an excellent experience. So we have a few speakers today. I'd like to first welcome and introduce Dr. Robert Knadel, our corporate board president, for a few words.
Good morning, and thank you, Dan. And I agree with you. You could not have picked or arranged for much nicer weather than we have this morning. I think that's very fitting for this event. It's a privilege to represent the VMH board here this morning and to share in this exciting event. This project to me represents much more than the beautiful medical facility that it soon will be. I personally see this project as a wonderful opportunity, a significant commitment to the future of and to the stability of rural health care. I view this construction as a continuation of the mission of VMH by providing the respected doctors, nurses, therapists, staff, and the community of Lafarge a facility which will much better meet the needs and represents the quality of health care being provided here. This truly is a special day for the greater community of Lafarge and for VMH as a community and as an organization. So congratulations to Lafarge, and again, what's a beautiful day, and thank you for attending.
Thank you, Dr. Knadel. A couple other words. We do have a guest book. I believe it's located over here at the refreshment table. We'd like you, when you have an opportunity, to sign in, please, and we can record who was here. Also, some other thank yous. Obviously, mentioned River Architects, but we're working closely with Market and Johnson, Kevin Renley, and their staff. River Architects is also collaborating with Bernard Schober architectural firm as well, and Ian Griffiths and his crew attending either by phone or in person several meetings from the Green Bay area, I believe is where Ian comes from. But other staff members that we've included from Vernon Memorial in the planning process. Greg Werner from our plant services has been certainly involved. Steve Burke has helped with our imaging piece of this clinic. Chris Iserman and Mike Norder from our pharmacy at the hospital have also had their eyes on the pharmacy plans that we will include in this project as well. Next, I'd like to call to the podium our Chief Executive Officer, Kyle Bauckham, for some words on this project. Thank you.
Good morning. Thank you. I echo Dan's thanks for you coming to this very exciting morning. Meeting the needs of our patients and the communities that we serve. The Farge Medical Clinic has had a long history of serving this community and the surrounding area by providing excellent care with excellent staff, meeting the needs of the patient and the community. Vernon Memorial has also had a long history of serving the communities around us by providing excellent care with excellent staff, meeting the needs of the patient and communities. Our mission at VMH, our triple aim, includes this statement: enhancing the patient experience. One way we do this is by providing local access to the services that our patients need. Many of those services have been available in the current clinic building, and that building has served the community, clinic staff, and VMH well. But there are growing needs for a variety of medical services in this community and surrounding area, and those needs require more space. Hence, a new clinic building is needed for us to continue to meet the needs of the community. This new facility will serve Lafarge and surrounding area for many, many years to come. Meeting the needs of our patients with quality staff, with quality outcomes close to home is central to the mission of Vernon Memorial Healthcare. I believe that strong healthcare, strong schools, and strong business make a strong community, and that is what Lafarge is. Working together, we are building strong and healthy communities. I too want to thank River Architects, Bernard Schober, and Market Johnson General Contractors, Dan, and all of the staff at the clinic who have put in countless hours to design this clinic. On behalf of Vernon Memorial Healthcare, I want to extend our thanks to all of you in the community that have supported not only the clinic but VMH. And I look forward to next year when we cut the ribbon and at the grand opening. Thank you for coming.
Thank you, Kyle. I'll just share a little snippet of wisdom that Dr. DeLine shared before we started actually meeting with River Architects about this project. There was a small remodel, an addition put on the clinic, I understand, a few years ago, and I don't think Dr. DeLine was expecting that he's going to be involved in another process like this, but he really led the charge and led the group and really was considerate of everyone's opinion and involvement in this project. So I'd like to call on Dr. DeLine as our medical director and longtime physician for this community at the Farge Medical Clinic to say a few words. Thank you.
Well, who would have figured back on that snowy day in 1983 when Ann and I and our little Michael tried to get into town that we would be in a situation like this so many years later, 30 years plus. It gives me pause, makes me think of all that's come before me, the history of the area, the history of medicine really in the valley, and makes me feel thankful as well for all that's come before me. So I just have such a sense of thankfulness and appreciation as I continue this work on into the future. When I think about thanks, I have to say that my family has to be first for a change. I think most of us in our lives and our work, when we are queried about what we're doing in this life, we always say, well, our family comes first, and yet we're committed to our work and our job. I always said the same thing, but I'll be honest with you, it was really never quite the truth. The practice always came first, and time again, I left the parties and the holidays and the special events and the dinner party or whatever to go out on a call or deliver a baby. And this has been the life of my family for over 30 years. They've been mostly patient, with it, and I just have to say that more than anything, I thank the support that I've had from them. Because as we all know, if you don't have that support, it's pretty difficult to have a rich and fulfilled life, and I definitely have had that. Secondly, the staff with whom I've worked has been an inspiration to me. So starting out with our staff of 3 back in 1983, Marcia Bader, who's still with us today, and Pam Sandmeyer from up by West Lima. And now look, we have a staff of probably 25. We're trying to hire another full-time physician. With any bit of luck, we may hire a full-time pediatrician for focusing on children with special needs in particular, genetic disorders, other disabilities, but for all the children. The other providers that I work with are a constant source of inspiration and passion for me. So I have Ben Agar, who for so many years has worked with me at the clinic. He's tried so hard to be just a fill-in guy, just to kind of fill in here and fill in there and work the ER and such. The problem is he's such a nice fellow that people keep coming to him, and he has difficulty meeting his real goal with that. And then Sean. Sean has been here now over 5 years, Sean Sedgwick, and has become such an integral part of the practice. Now increasingly people call and they want to see Sean, and this has been such a source of joy for me as the first years where people wanted to see me. Well, as time has gone on, we've developed a whole set of strong providers, each of whom are just loved by their patients, and Sean has certainly led the way in that. Kelly Shetter now has been with me for over 10 years, I think, and she came right out of her training program and has become such a talented and amazing practitioner for our community. So she's been day in and day out over all these years, and we look forward to her leadership and guidance in the future. More recently, Tamsin Morgan has joined us. It was a real coup d'etat for us to have Tamsin come to our community. She's now been here several years and is loved by many. And so, as I say, we have such a strong staff of providers, each of whom is cherished by so many patients, and yet we work integrally together, collaboratively, every day discussing issues in patient care, from patients in the nursing home to our hospital patients, to new concerning diagnoses in the community. So we all are aware of what's going on, and most patients feel when they call at night they don't get some kind of blank voice who doesn't know what's going on. We know what's going on, each and every one of us, and it really is a help and reassurance to our patients. It makes so much smoother care when the staff from the hospital call and the nursing home. We definitely know our people. So although we enjoy the growth in the practice and the ability to take on more help, it does make our lives a little easier when we're not basically on, although Sean and I are still pretty much every other night at least on or backup call. Still, there's something about a smaller practice and a smaller clinic which you can't reproduce in other settings. So while I'm looking forward to the day when we have a new full-time clinician in the practice to join us and we have the space to put them, my hope is that that's about where it stops, that we work into a system that will work collaboratively, work hard, always have fresh blood, and yet not just keep growing, because there's something pretty special about a small, intimate group, which is what we have right now. So I'm hoping we will be able to maintain that even, and I suspect that that'll be the case. The rest of our staff similarly works with passion at the clinic. So there's a sense of mission when we come to work every day and when we talk and have our meetings. People are all invested. They try so hard to do the right thing with each patient. We are not flawless, not perfect, but everybody there tries so hard each and every day to do the right thing. I've been at meetings where they've talked about the receptionist at a medical office building, and it's been described as the highest stress position of many different kinds of positions. And when I'm out there seeing all the stuff that's going on, from people coming in the front door with injuries to phone calls coming in and simultaneous questions, and of course our little space makes it even a little more challenging because there's no real privacy there, which will change, of course, with the new building. But people at the front desk really do an excellent job, and all of our nursing staff, all of our other staff are working so hard. So it's been such a pleasure to work with this team. Throughout this project has been the same thing. We've had meetings with the architects, typically 4-hour meetings, about every 2 weeks for the last 3 months or so. And all the staff there giving input, spending extra hours and time, working on their part of the clinic, giving guidance on others, to try to come up with the best plans. It'll be intimate, it'll be welcoming for people, it'll still maintain the small community kind of atmosphere. So it's just been such a delight, and I feel so blessed and so thankful to have had such a good staff and support from the community. So I just want to thank you all for coming today, particularly thank all the staff, and then all the workers that have been working on designing this project. I want to say one more thing about the VMH system. It's a little hard for me to come up in a little t-shirt as a company boy. As you know, I was in private practice for 20 years. That is kind of who I am and how I see the world. It's not that easy for me. As I thought of the stories of Doc Gollin and others who've come before me, Doc Gollin was here for 25 years and somewhat abruptly decided to leave at one point, and such a well-loved physician, did such a good job for this community, and then one day he was gone and the clinic was closed, and there really weren't any services here for a long time to come. As I thought about that, and as I aged, I thought a little bit about issues of transition. What will come beyond, what will come after, and can we maintain what we've been doing over this period of time? We were getting busier, the complexities a bit more, and I've always worked so well collaboratively with our local community hospital, but never was affiliated. At that point, I considered and talked with Gareth at that time. We chatted a while about things, and I decided to join VMH in a more formal way, which is not part of Gunderson, it's not part of St. Francis Mayo, it's not part of UW or Dean Care. It's an independent rural hospital system, and that's pretty important to me. I don't think I could really work in a larger system or Aurora Care or such. And I have to say that throughout this decade or so now that we've been affiliated, there's been a real sense of respect, mutual respect between VMH and our little clinic here in Lafarge. I think when we joined the system, they thought to themselves, they've got something special going in Lafarge, and maybe we are wise not to mess too much with it, just let them do their work. And that's really what's happened. So for the most part, they've served as facilitators to the work that we're doing, trying to give the background and the support, but not interfering or mandating that we change in any way what we're doing. So when we schedule patients, we schedule them the way we think we need to schedule them. And when we see patients in the office, that's the way we do it. Our style, you probably have a sense, hasn't really changed. And so I really have to say that they've been a good partner to somebody who's not easy to partner with. And suffice it to say, this certainly would never be happening if this was still my practice. I would have patched on a couple more rooms on the back, and we would have struggled along and gotten through as best we could, though the facilities may be inadequate. And my initial bias when we looked at this project was to do just exactly that. But some of the younger ones in the practice said, as busy as the practice has become, and is vibrant and passionate, and as much as it's going on, perhaps it makes sense to look to the future and maybe have a building that really meets the needs of a larger practice in a more efficient way. And as I listened, I decided perhaps they were right, and gradually, of course, came on board and have been quite excited about the prospects. I just realized as I looked and saw Lisa and Kate that I didn't introduce our midwives, who've also been an exciting part of our practice. For 20 years we've been delivering basically the Plain community in our little practice here. And for the first 10 or so, I did that kind of 24/7. It was a fairly significant venture in terms of time and energy. Lisa came on board a number of years ago and began helping me in that way, and has had her own training in addition and also worked here, and has become as talented of a midwife as really anyone around. And if I was pregnant, I'd be more comfortable with midwife like Lisa than anyone in our whole group, including all of our physicians and such. So I'm very proud of her contribution to the work. Her participation has elevated the level of care beyond what I was able to provide. And now we have the bright young face of Kate, who's been with us now for several years, and we hope for many years to come. So I just want to thank you all for coming, thank all my staff and the provider group, and thanks again.
Thank you, Dr. DeLine. Certainly a big part of the reason, the need to have this expanded clinic has been the wonderful work Dr. DeLine has done for this community for several years, and really appreciate his work here. Well, for a glimpse of the future, perhaps we should call Dr. Sedgwick, who's been here now 5 years, to the podium to say a few words and share what this project may mean for us in the future. Thank you, Dr. Sedgwick.
So when I was asked to come and speak today, I thought I could try to do the same thing that Jim does and actually be profound, and it's just not really my style. So I started thinking about the coming to the Farge Clinic initially, and seeing some of the quirky things that happen in the office, like as you're walking down the hallway, there's sort of this unwritten rule that if you're walking down one direction, somebody's walking the other direction, the first one to hit a doorway backs in and the other person goes through. And then we have the back office with the copier that has that beautiful orange shag, that I'm sure we're all gonna miss. We have the kind of cramped space in the lunchroom, so at noontime you always kind of feel like you're running back going in to try to get a cup of coffee. You come in the door and you have to weave one direction, go the other direction around the table, back away from somebody who's at the microwave, and finally get to the coffee, and now you've got hot coffee and doing the same thing. So I'm sure all of those types of things we're gonna look back on and kind of miss a little bit, because it really makes the practice much more intimate. And Jim talked about this being a small practice, and that people are very invested, and to be able to put up with those kinds of things, or to be sitting in your office and hear a birth happening 12 feet away, those kinds of things are certainly show the commitment that everybody has in this group. Yeah, we had these extensive meetings that people have talked about for getting the new clinic going and figuring out the space, and we had all the staff there and all the brain power, and then I was there too, and then we figured out all kinds of changes that I'm sure will mean that we won't have the same quirky things going on in the clinic, but probably we'll have some new ones that we didn't think of. As far as the future of the clinic, we did do quite a bit of thinking ahead of time, readjusting space, increasing our birthing space, because the midwives do such a fantastic job. And we are having enough times where we're having a couple deliveries at the same time that it's worth having that extra space. We're adding an extra space for consultation, so that we can hopefully get people in from Viroqua and La Crosse do consults here in La Crosse or in Lafarge, so closer to home. And working on Dr. DeWine in particular has been working with some groups out of Madison in England and out east for helping kids with genetic disorders and doing treatment for that. So we've got extra consultation space for that. We're going to have new x-ray equipment that hopefully we'll be able to shoot x-rays without blowing the fuse and then shooting the x-ray again and blowing the fuse, and we did set up enough space so that we can add an additional provider, plus added space for students to come in, so that we can try to impart to students going through the various systems, the PA schools, med schools, what it means to be out in the rural community and what it means to deliver rural health care. So all of these things together are integral part of what we're hoping to do with the clinic in the future. What I'm personally hoping for is that a little bit of Jim's foresight and ambition and kind attitude will rub off on me, and I'll kind of get a little bit closer to what he's at. But I decided for keeping my hair, though. He chose differently, but yeah, it's so we're all very excited to have the new facility. I think for those of you who've had a chance to look at the design, I think it's a neat design. It's a smart design. It's not not by any means over the top for an extravagant building or anything, but it hopefully will be very functional. And the biggest part of that is it will hopefully allow us enough space and enough room that we can get people into rooms efficiently, so that we can provide care more rapidly and people can have a much more pleasant experience, and you're not having as much waiting time and those types of things. That's our hope for the future. And we're, the great thing about the new clinic is that we're actually keeping the same staff to move in to the new clinic. We've got some fantastic people who really try every day to do the best they can. So thanks to all the staff, and we look forward to being in the new space. Thank you.
Thank you, Dr. Sedgwick. I too was trying to keep my hair for many years, but it didn't work. One of the aspects of care that Lafarge Medical Clinic has provided for so long has been taking care of about anything and everything that walks through the door or that limps through the door or whatever. So there's a lot of emergent cases that are treated at this clinic. And so when we were looking at properties and availability and transportability of emergent cases using ambulances and so forth to take people to another location where they might need more care than they could provide at the clinic, that became very important in the whole process. And early on in that process, I think we've had conversations with Greg, who heads the ambulance service here in town. He happens to be on the corporate board, foundation board for Vernon Memorial as well, but on the village board here at Lafarge. So we'd asked him to say a few words too about this clinic and the community. Greg Lawton.
I've got a lot to follow, but all I can think about is Dr. DeLine if I were pregnant. It's an image I'll have for a while. On behalf of the Village of Lafarge Board, I'd like to welcome you all here to mark the beginning on a much anticipated new project. I'm fortunate to have extensive involvement with VMH and the Farge Clinic staff as, like Dan alluded to, chief of our local ambulance service, chairman of the medical committee on our board here in Lafarge, and now newly serving on the VMH Foundation board. So I think the timing was kind of neat to start this off. Dr. DeLine served as our medical director of our ambulance service for decades, and now has passed that torch on to Dr. Sedgwick in the recent years, and he's very involved in directing our protocols and attends our meetings and trainings. If you talk to other people around the state, most people don't even know who their medical director is when you talk to other ambulance people around the state. So I think it's pretty neat here in Lafarge that we're connected. He comes to meetings, he's involved with us. Plus you see him on the street. So we're unique in that facet. We're also very privileged to have access to a high level of medical care right here at home, and we're even more blessed to have a new facility on the way with expanded services. Not only for Lafarge residents, but I do find it amazing, especially the patients we transport. There's a lot of EMTs in the crowd here. They would probably agree the distance that people travel to come to this practice. It's not just Lafarge residents and Lafarge area. You see people with Toma addresses, Laval, Genoa. I can think of one that transported himself to Lafarge with, a broken limb from down on the Mississippi. I mean, think about what that says. So from behalf of the Village of Lafarge, thank Kyle and the VMH board for progressing with this project, and most importantly to the Lafarge Clinic staff who continue to provide the service here. Our community eagerly looks forward to completion, and it will be truly a great addition to the community. Thank you.
Thank you, Greg. It's maybe an unorthodox time to introduce myself. I didn't really do that. You probably have programs. My name is Dan Nelson. I'm the Assistant Administrator, Clinic Operations. I've been working closely with this Lafarge Clinic group, especially with this project, but also with all of our other clinics. And I also oversee therapies and cardiac rehab for our organization. And this has been a delight to travel to Lafarge an extra day every couple weeks to attend these meetings and be involved and really just listen to a lot of great ideas. So thank you again, staff. That about does it for our speaking today. A couple words of housekeeping, kind of. We're planning to take some photos next. We're going to start with the Lafarge Clinic staff. They agreed to meet us halfway and move this back a little bit. But I know they're all chomping at the bit to go provide great care to their patients today, so they would like to get back to the clinic. But our location for photos today will be a little bit to the left of the sign. I'm told that the digging there is a little bit easier. You guys only have to go 4 feet down. But then I will be calling different groups afterwards. So again, thank you. Corporate board members for attending, foundation members, friends, members of the community, businesses, our workers, the Market and Johnson, River Architects, and everybody else that I forgot to mention. I apologize.
It's neat to see that they've started moving dirt out here already.
Part of the mission of Vernon Memorial Healthcare is providing access to all of the medical services needed in the rural area. And it's so important to Vernon Memorial to provide those services here in Lafarge and the other small communities that we have.
It's amazing. I mean, obviously a lot of the locals use it, but people come from all over, and I think that says a lot about the practice.
It'll allow us to have patients in rooms more quickly and efficiently, so they're not having to wait nearly as long as what they had been.
To have a few more exam rooms so that we aren't on top of each other trying to scramble for space.
We'll have the space to invite another doctor to come to our community to take care of our patients. We'll be able to see more patients because of that.
I was just talking with a man who said, wow, everything is on one floor. There aren't going to be steps. And that was what we wanted. We wanted doors that opened nicely. We wanted entryways that felt comfortable.
We're going to be able to offer some outside services from specialty doctors such as podiatry, genetics, psychiatry, hopefully maybe some other things like WIC. So we're going to be able to expand what we already do here, which is really great community care.
For folks in this community to come and see their provider right in town and not to have to travel 20, 30 miles to see their provider, how exciting and important that really is.
When the whole department, the whole staff was involved with the project, we knew early on this was just going to be an amazing facility, yet appropriate for this community.
I hope that they have the sense of modern medical care provided in a homey, small-town atmosphere by people who are well acquainted with them.
We wanted something where people would walk in and think, wow, you know, it's clean, it's safe, it's comfortable, it's professional, I feel welcome.
I'm just excited, and I know all the staff is, and I feel that it's been a real collaborative effort, and I'm quite proud of all the providers and all the other staff we have.
Since 1972 with the sawmill, it's been noisy and busy for all those years. And for all the silence now, I don't care for it like that. I'd rather have more action going on, which this will be really nice.
We want it done sooner than 1 year, but it'll be exciting moving forward, knowing that it's coming. And I think we heard today too that the staff is excited to have better space to take better care of their patients as well.